Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so excited to introduce our guest today. What a special thing. We have Julie Rudman, and she is the founder of the Breast Cancer Club. Let me tell you a little bit about her. She's a pretty cool person. So in the late summer of 2023, just days before Julie and her husband David were to send their youngest child off to college and begin this new phase of life, Julie was diagnosed with breast cancer at just a routine mammogram. She was fortunate to receive her treatment at the hospital where her husband, a doctor, also practiced medicine, to be cheered on by her sweet, knowledgeable husband and loving family and friends. But even with the best case scenario, cancer was difficult. And all the while, she kept thinking, how is everyone else doing this? After learning that most of the local breast cancer support groups were gone, she decided to form one. A native Kansas Cityan, Julie founded the Breast Cancer Club to offer free, anonymous, multilingual, inclusive online breast cancer support to the greater Kansas City area. The website launched in June of 2024, and Julie is the proud mother of 3 kind and talented grown children. She enjoys reading, baking, practicing yoga, watching football, and walking in their neighborhood. She also loves modern design, houseplants, and all the dogs and all the babies. With that, let's get to Julie.
Hi, Bryce. Thanks for having me.
Yes. Okay. So we're going to be talking about such an important topic. We're going to be talking about breast cancer. And you started a club called the Breast Cancer Club. And I think you have turned your diagnosis into a way to transform people's lives that are going through something similar to what you experienced.
I hope so. Thank you.
Yes, I am so thankful that you're doing this because I think breast cancer is something that we probably don't know enough about. And we were talking ahead of this interview, and that a lot of the things that we think as women about breast cancer are old news. They're not things that are the current statistics, the current treatment, the current knowledge that we have around this. So can you talk to us about what some of the misconceptions of breast cancer are and what facts you wish more people knew about?
I'm going to start with the bad news, and that is that breast cancer is on the rise. It is dramatically on the rise. The last set of data we have is a 10-year set starting in 2012, and that was that breast cancer has been going up on average 1% per year. That is on average. So for white women, Black women, and I believe it was American Indian women, it was 1% per year. I think it was 1.4 for Hispanic women. The largest gains were in AAPI, so Asian American and Pacific Islanders. And that was, I believe, 2.5% per year on average. It is going up dramatically. And the other important thing about that is that the age at diagnosis is dropping. So this is no longer an old lady's disease. I think that the average age at diagnosis is probably 62, but it is going up rapidly in people under the age of 50. I'll tell you, I did an event a couple weeks ago, and was outside for a couple days talking to people at a like outdoor shopping event. So it wasn't a breast cancer thing or anything. And I met that weekend a 27-year-old. I met 2 29-year-olds, and I met several people in their 30s. And as I was relaying that information recently to a radiologist, she said that she had diagnosed a 21-year-old. Wow. So I think it's really important to understand that you are at risk. If you are a human living in the modern world, you have some risk of breast cancer. And I'm going to say also that we are not just talking about women. If you have breast tissue, you can get breast cancer, and every human being has breast tissue. So men get breast cancer too. It accounts for probably less than 1% of all diagnoses, but everybody can get breast cancer. Those born female, those born male, anyone trans, intersex, non-binary, anyone can get breast cancer. So I think that's really important to know. I think it's also really important to understand that you are not in the clear just because you do not have a family history of breast cancer. That actually accounts for a very small percentage of breast cancers. It's probably in the 5 to 10% range of breast cancers that are caused by genetic mutations. I think that's really important to understand. I think it's also important to understand that you cannot prevent breast cancer. There are things that you can do, but I do not like the word prevention. We talk a lot about cancer prevention. I think that we need to use the terms risk reduction. There are far too many non-modifiable risk factors. So the things that you cannot control, being born female is the number one risk factor, right? 99% of breast cancers are in people who are born female. You cannot change that. You cannot change your race. Those white people are most likely to be diagnosed with breast cancer. You cannot change your family history. You cannot change the age when you got your first period. That's something else that if you got your first period at age 12 or younger, you're at higher risk. Well, the average age of first period is now something like 11 and 9 months or something like that. So the average person now is under that. So far too many non-modifiable risk factors. There are other risk factors that are probably technically modifiable, but you're not going to. So one of those things is the country that you live in. The United States is a hot spot. If you live in the United States, you're at greater risk of breast cancer. If you did not breastfeed, you are at greater risk of breast cancer. If you're probably not going to change whether you breastfeed or not, just to lower your risk. The age when you had or whether you have children, and then the age at which you have them, probably not going to change that. Mm-hmm. So what that leaves then is the things that you control are things like how you eat, whether you use alcohol. There is a strong positive correlation between alcohol use and breast cancer. We've known that for a long time. Whether you smoke, obesity, things like that, those are the things that are in your control. And those are the places where you can make changes to lower your risk, but you cannot prevent breast cancer. I think it is really, really important to understand how survivable this is so that you are not afraid to screen. Mm-hmm. You're not going to get breast cancer because you had a mammogram. You either have it or you don't. And if you don't have it, that's a great feeling when they tell you all clear. If you do have it, it's a great feeling when they tell you we got it and we can treat it. It's a great feeling either way. My familiarity with it was old news. So it was like my mother's generation and my mother's experience of breast cancer. And it's very, very different. Since then, it's way more survivable and way less toxic, the treatments.
Yeah.
Yeah. Yep.
Do we have some good news around this?
Absolutely. So here's all the good news. Breast cancer is not a death sentence. In communities where people don't talk about breast cancer, you may only know the people who have died from breast cancer. But there are so many people walking around who have survived breast cancer. So statistics on breast cancer survival are usually given in terms of 5-year survival rate and then 10 and on. What that means is relative to someone who didn't have breast cancer, how likely are you to be alive after 5 years? And the overall statistic, now remember there are lots of kinds of breast cancer, but the overall survival rate of 5 years is over 99%. Okay, that's an amazing thing to know. Yes. When we talk about breast cancer, we talk about catching it. Sorry, I should have explained in the local. So breast cancer will be described either as local, regional, or distant. Local breast cancer is breast cancer that is still confined to the breast. Regional means that it has spread to lymph nodes, and then distant means that it is out in the body. If it is caught at the local stage, it is over 99% survivable, 5-year survival rate. Regional is 87%, distant is 32%, and that highlights the importance of early detection.
Yes. So is a mammogram the only way that we can do early detection? How about
Well,
being familiar with our breasts? Like, where do all those things fall in?
mammogram is the gold standard. So mammogram is something that if you are eligible for it, you should be doing that. Now, there are other things to know about your breast, but I think we should talk about screening. There is no official guideline. There are organizations that will put out their recommendations. But in general, if you are at average risk of breast cancer, age 40, is when you should do that, when you should start screening. Some people talk about having a baseline mammogram at 40 and then beginning screening at 45. Some talk about having a baseline mammogram at 35 and then start screening at 40. Some people talk about screening every other year. The best thing to do probably is to see a physician and determine whether you are at average or elevated risk. If you're elevated risk, that screening recommendation will probably be about 10 years earlier. So about age 30, you may be advised to have a mammogram once a year and an MRI once a year. So you would do those every 6 months. Mammogram is still the gold standard. Now, there are other things that you can do. You really do need to understand your body. You need to look at your breasts, you need to touch your breasts, and you need to understand that breast cancer can present in about a dozen different ways. So most of us think about a lump. That's what I always heard about was, checking yourself for lumps. That is just one way that breast cancer can present. So you want to check for changes to the nipple. The nipple can invert or turn inside. The nipple may have discharge. There might be crusting. You want to check the skin. You might have thickened areas. You might have like an orange peel texture on the skin. You might have a vein. It might be red, hot. Could dimple, could ripple, could have sores. There are just a lot of different things that can mean breast cancer. So you do need to know what is normal for your breasts.
Yeah. Okay. Can we go back and talk about what a mammogram is? Because I think a lot of times people also are afraid of getting a mammogram, worried that it might cause cancer or it hurts, right? Like that it's like so painful. I know that when I had my first mammogram, I was a little bit nervous about like, what is that going to feel like? And so can you talk to us about that?
Well, I'm going to say it's nobody's favorite thing to do. So let's just, seriously, it's nobody's favorite thing to do. But it isn't bad. It doesn't last very long. In general, I wouldn't say that it's painful. It might be a little uncomfortable. I always say that a woman did not design that machine because the weirdest thing about it is that, your head is at a 90-degree angle, but it isn't something that lasts very long. Nobody's favorite thing to do, but I wouldn't say that it is terribly painful. No.
Yes. Well, I when I was doing it, and I think everybody's pain tolerance and experience is probably a little bit different, but I was like, it was tight. It was definitely squished. Right? Yeah. My breast was definitely squished in there, but it wasn't causing me pain. It was just like tight. Like it just felt like not my favorite feeling, but I didn't feel like actual pain sensors happening. And so I think a lot of times people are like, I don't want to do it because it's like so uncomfortable. And I thought like after I did that, I was like, not that I want to, but like that's not something that I'm like, I can definitely do that again.
Yeah, absolutely. Yeah. You can. We do a lot of things that are painful as women, and that's something that nobody's favorite thing to do. But I tell you what, you feel great every time afterwards. There's if you go in and they tell you everything looks great, all clear, come back in a year, that's a great feeling. Yes. On the other hand, if they catch a cancer, it is also you're going to want to catch it early. If you've got cancer, you're really going to wish you'd caught it early. So it's a great feeling as well to know that your cancer was caught when it's still treatable.
Yeah. Well, and also I think we were talking earlier about like people being afraid to screen. Right. And I think your message was don't be afraid to screen. right? Like this is, you get information. So if you
Yeah.
do have cancer, then you
Yeah,
have the information. You can do something about it. If you
absolutely.
don't have cancer, then you can be like, okay, checked off the list and then come back next year.
Absolutely. And again, going back to what we were talking about with early detection, in my case, first of all, Michael Farber, I say his name every time I talk about my diagnosis because he saved my life. He caught my cancer when it was 95% survivable. I have a kind called invasive lobular carcinoma that does not make lumps. And he caught it at stage 1 on a mammogram. Because of that, my survival rate is 95%. If it had been out into the body, it is a 22% 5-year survival rate. It's an amazing feeling when your cancer has been caught, when you can still do something about it. It is an amazing feeling to, it's like a second lease on life.
Yeah. Yeah. Well, and I like how you point out that so many people have had breast cancer and they're just not talking about it. What do you think about that piece? Like, what do you think would help women to talk more about having cancer and surviving?
Yeah. We could talk an hour about that, Bryce. We really could. There are so many ways to go through this journey. Some people, when they are diagnosed, will come out with it and, put their lives on social media and document every stage and every treatment. And other people will wait until after they're finished with it to talk about it, if they ever do. There are some cultural components to that. There are communities where there's still a lot of shame and stigma about breast cancer. There are communities, there are still people who believe that breast cancer is contagious. There are a lot of people with, I call them religious fatalism beliefs, where, God decides if you have breast cancer. Breast cancer is a punishment from God. If you have faith in God, you won't get breast cancer. So then, if you get breast cancer, what does that say about you?
Mm-hmm.
And there's just still some embarrassment. And I know a woman who was private about her breast cancer. She's a working mom with 5 kids. She does freelance work and she was afraid she would lose clients. And so she deleted all her social media and she turned her camera off when she Zoomed for a year until she had enough hair that could pass for a hairstyle. And then she turned it back on, and she eventually told the people that she, worked with, well after she was finished with it, she was ready to talk. So there's just a lot that goes into it. It has to do with how private you are. It has to do with how comfortable you are with your body. I mean, we're talking about breasts.
Sure.
How comfortable you are about sharing anything, how you feel about your body, how you feel about your breasts. For some people, that is not a big deal. For some people, it is an existential, threat that I've talked to many women who just feel like they lost their identity. So it has to do with all of that. Now, if the cost is not too high for you personally, I do recommend that you talk about your breast cancer. Number 1, to get support. And number 2, because if you are open about it, you can help somebody else. When you're open about your breast cancer, you have the ability to raise the rates of screening in your community. And I think it's a great thing if the costs are not too personally high for you. But I have spoken with many people who did not talk about it. I've spoken with people who told, just their children, spouse, maybe their siblings. I spoke with a woman who told her sons, and she decided she would call her first cousins, her female first cousins, just to let them know that they might want to get screened. And when she called, she had 5 female first cousins. When she called them, one of them was going through breast cancer treatment at that exact same time, and one had already been through breast cancer treatment, and they hadn't told her. So we are all just really different about that. But I do think that if the cost is not too personally high for you, that is very helpful to other people. And I think that it helps you as well to get support. The people that I talk to who seem to do the best are the ones who had the support of their village. Yeah.
Yeah. I think in general in life, that is just such a good place to come from, is support from your village, but especially when you're going through
Yep.
something so challenging. And
Well,
I think, it can be hard for people to ask for help.
oh yeah.
That's something I struggled with in my cancer diagnosis, is asking for help, because I could do it all myself.
Yep.
I mean, I could before, but when I was in the midst of it, and the truth is I could before, but it was at a cost, right? Like, and I wasn't thinking about the cost, and also like how it impacted other people that I did everything for myself. And it was humbling for me, and also like such a opportunity for growth for me to ask for help, and how well people responded to my request.
Absolutely. Yep. The data shows that people are much more willing to help us out than we think they are.
Mhm.
Most people
Yes.
want to help and they just don't really know how. It's
Yeah.
really hard to ask for help. Most of us love to offer help and don't like
Mhm.
to receive it. But another way to look at that is that you really do bless other people when you allow them to help you.
Yes. Yes.
People feel so good when they do something helpful for somebody else, that there's a term for it. It's called the helper's high.
Mhm.
And you allow other people to feel that. You allow other people to experience the same benefits that you feel when you help, when you allow them to help you. And the data shows, we are social creatures. We are meant to live in a state of interdependence, and that we are happier and we are also healthier when we are living in a state of interdependence, which means offering help and receiving help. I also am incredibly independent and like to think of myself as very capable. I always did everything by myself.
Mhm.
Um, I remember, well, my husband's a doctor, and he schedules months out. So I have never been one to, ask him to come to doctor's appointments with me for myself, with the children during pregnancy. Um, because I don't want to disrupt somebody else's schedule. Somebody has been planning for their appointment or their surgery, and I'm not going to disrupt that just because I'm nervous. And so, I tend to do things myself. But I tell you what, when I drove away after that mammogram where they found something, I was a terrible driver. And I remember sitting at a stop sign like it was a stoplight, and sitting and waiting and waiting. And then I realized, oh my gosh, I've got to go. I was a terrible driver. And so after that, I did not drive myself at anything that was possibly going to make me nervous. And it was actually really fun to have a friend pick me up and drive me, to a biopsy or an MRI or surgery or whatever. It made it more fun. And it felt really good to have a waiting room person. I'd never had a waiting room person before.
Mhm. Mhm.
Felt great. And that was something that I learned, really, was to let people help me. I had a friend come with me to my first radiation. You know, it's not a big deal. It's just weird, like the first time you do it. And
Yeah.
he took me to my first one. And then we went out to brunch afterwards, and, just it's kind of a good memory for me. So I'm really happy that I let people in.
Mhm.
There are so many ways that people can help. Um, and asking is hard. One of the things that we did on the Breast Cancer Club was create a support registry. So it's like a wedding registry
Mhm.
for support, so that you can, it's kind of a permission structure, so that you can just check a box of whatever kind of help you'd like to receive. Most people
Mhm.
food,
Mhm.
bringing food. And, that's not the only way, and it's not even always the best way to help somebody. So we have, probably 21, I think, categories of different ways to help people. You can just check a box, because sometimes what you need is, you need your daughter driven to soccer, or
Mhm.
you need, your garden maintained, or your lawn mowed, or your snow shoveled, or laundry. A lot of people, you can't lift more than 8 pounds after surgery for quite a while. Your laundry basket's more than 8 pounds. So
Mhm.
there are just so many ways to be helpful. A lot of
Mhm.
people think of food. That's kind of a default. For me, I have so many food sensitivities that you would hurt me by cooking for me. And the other part of that is my husband is a terrific cook. And
Mhm.
so that was a way that he could help out. And if I had taken that away from him, that would have actually been hard on him and not helpful. But the problem is, if you don't know of anything else, a lot of the times people offer food, and then if you decline that, then you're kind of left with nothing. So that's the support registry.
Yeah, I love that. Well, and people would say, like, what can I do to help? And sometimes you don't know, right? Like, I think in the midst of that, you're like, I am so in the whirlwind that, like, I am like literally living in this exact moment right here.
Yeah.
Just this one. Yeah.
Yeah. People are really well-intentioned. But when you say, let me know if there's anything I can do to help, or what can I, you're putting the burden on the person who's overwhelmed.
Yeah.
To come up with something that you can do for them. They don't always know. They might know, but they might not want to ask for it. It is very uncomfortable for a lot of people to ask for, something specific. The better thing to do is just kind of to announce that you're doing something. So I had, so one friend said, let me know if I can go with you to your biopsy or whatever. And I thought, my gosh, I mean, I'm here in Leawood. She lives in Mission Hill. She's going to have to drive all the way to Leawood, and then she's going to have to take me to the hospital, and then back to drop me off in Leawood, and then drive all the way to, and I thought, that's too far. Another friend said to me, I'm going to take you. What time is it? And it was like, okay, well, it's at 11 o'clock. I'd love that. And, just going like, well, she doesn't live too far away, but, something specific. A friend said, I'm going to bring you dinner on Monday night. If you would like any say in what that is, now's your chance. So very forceful, or I'm, declaring what you're going to do. Most people are a little more open to that, or maybe giving them options. Like, I have some free time on Saturday. Would it be helpful if I took your kids to their games, or would you rather I come over and help you, around the house or something like that? Options are nice, but yeah.
Well, and sometimes it's just nice to have somebody to just sit with you, because sometimes in cancer treatment, especially, you're tired too, right? Like, people doing things is helpful, but sometimes, like, you just want a companion, right? Because you don't feel like going out to breakfast. You don't feel like going out to dinner. Like, it's just too much. And so sometimes it's just like bringing it to me, right? Like, bringing that event to me, it feels good too. But like, taking our kids to events, I mean, we are so inundated with all things. I know, like, as parents, we have busy schedules. And so, like, imagining how we're going to get the kids to the different places, right? And that's overwhelming. And so, like, definitely help on that is amazing. So talk to me about what the Breast Cancer Club you started, and what things do you guys offer for the community, but also, like, what was your motivating factor for starting this Breast Cancer Club?
Well, I'll start with that. The motivating factor was that when I was diagnosed, I went to the internet looking for support to see what was in Kansas City. And I was surprised how little I could find, and that there just wasn't anything that I was going to take advantage of. And breast cancer was really hard. And I just kept thinking, if it's this hard for me, I don't know how anybody else is doing it, because I had a cancer that I knew that I would beat. My husband's a doctor. I was having my treatment at the hospital where he has worked for over 20 years. We knew these words. We know this language. We know the providers, and it was still hard. I've lived in Kansas City almost my whole life. I have family here. I have friends here. I just kept thinking, what do you do if you're new in town? What do you do if your job and your children are your focus and you just have not built a community yet? I didn't have a job that I was, missing. I was diagnosed. I've been a stay-at-home mom, and I was diagnosed, I think it was 12 days before we became empty nesters. So I was getting my son off to college, and I just had myself to deal with. I kept thinking, I don't know how you do this if you're missing work. Obviously, I speak English, and it's not, hard for me to communicate with physicians. So I tried to create something that just had as few barriers to access as possible. So our website displays in over 100 languages. So that there are over 100 primary languages spoken in Kansas City, and everything on the website translates. Every post that's been made on the website and all the information there translates at the push of a button in over 100 languages. It's free. It's anonymous. A lot of people are, as we said, not public about their breast cancer. Mm-hmm. So it's anonymous, and it's available 24/7. You don't need to be available during business hours. You don't need to have transportation. You don't need to have the courage to talk about your cancer in public. So the website has like a social network component to it where you can discuss whatever you need to discuss. The conversations last week were, one was about sexual dysfunction, which is a real thing because so many people are on hormone blockers to treat their cancer. Another conversation was about hair restoration, that someone still had some hair loss after chemo. The neat thing about this is that we're able to talk about this locally. So there are other breast cancer websites, but it's super helpful if it's local. So the person who was talking about sexual dysfunction, we're able to say, oh, Dr. Schwartzman does this, or talking about hair restoration, Dr. Singh does this. So social network component to that, we have some communication tools that help you communicate with your friends, your family, and your physicians, because communication is at the heart of everything. We have a tool that allows you to share a cancer diagnosis. You will get these same questions over and over. And so this is a form where you can just check the box and fill in the blank and then download it and send it, and then use that time savings on something that's a little more pleasant. As I mentioned, we have a support registry. We have some communication forms to help you talk to your doctors. There are a lot of things that patients wish that their doctors knew, but the doctor doesn't ask, or they want their doctor to know it, but they don't want to say it out loud. A lot of these side effects and issues of breast cancer are very, very personal, and a lot of people don't want to talk about them. But you can check a box because you still need help with them. We have links to local resources, all the nonprofit organizations that are either based in Kansas City or have a presence here that offer free services that might be helpful. And then we also have some sections that are relatively new. We just started one a couple months ago that is discounts at local businesses.
Cool.
So yes, local businesses that offer products or services that would be helpful during or after breast cancer. So we have everything from community centers like all the YMCAs in town and the Jewish Community Center. We have gyms, we have healthy restaurants, we have hair restoration places. Have a makeup artist who can help you. What do you do when you have no eyebrows and eyelashes? How do you take care of skin that has no moisture because you're blocking your hormones? On and on and on, tackling this from every angle. We've just launched some videos. So the idea is, to democratize breast cancer support, that we are not all getting the same support after diagnosis. We have providers in Kansas City who are making videos of information that might be helpful to you because of breast cancer, and then you can access it for free in the privacy of your own home.
Nice.
Up there right now, we have a meditation teacher, we have a yoga teacher, breath work instruction, one that I'm getting ready to put up, which is manual lymphatic drainage. A lot of us deal with lymphedema or swelling in the arms as a result of breast cancer treatment. So tons of materials. It's free. It's anonymous. All you have to do to become a member is just give us an email address so that we can send you an email. You click on that link. That's how we know you're not a bot. And that's all. Super private.
Amazing. So helpful. Okay. So I know that parents often try to, and we kind of talked about this a little bit, but like maintain their status flow, right? Like do what they did before with a cancer diagnosis, whether it's about caregiving, work, just the normal life. And can you speak to how likely that is that we're able to do that?
Yeah, not really. I'm going to say not really. And then I'm also going to say, but don't feel bad about that.
Mhm.
So most people I know, especially most people who are raising young children, are operating at full capacity, right? We are already saturated. Most women are working outside the home these days. Most people are busy with children's activities, and you may also be taking care of elderly parents at this stage. Most people are fully saturated. You cannot absorb breast cancer. It's too much. And I'm not even 2 years out from my diagnosis, and I have had 80 doctor's appointments. I did not even have a bad cancer journey. My 81st doctor's appointment is this week. I have an MRI this week, number 81. Who can absorb 81 doctor's appointments without something giving?
Mhm.
Now I will say, do not feel bad about that. So we've talked a little bit about this. People want to help you, and are much more willing than we give them credit for. The other thing I will say is, people say, they feel so bad about their kids. And, that was the first thing that I thought, first thing I said was, I cannot believe I'm doing this to my children. And every person I talk to says that the hardest part, the thing they dread the most, was telling their children. But I talk to so many people about the impact of breast cancer on their children, and without fail, they tell me about all the positive results. So over and over, they describe their children as more independent. Isn't that what we're all working towards? I mean, we are trying to raise humans who can function without us. Over and over, they describe the independence, the resilience, the self-sufficiency. Everybody can do something to help, no matter what age your child is. We have a member whose girls were in college and not around. They showed their support by one daughter shaved her head in support. The other one said, not doing that. She ran a 5K. So they got involved in some breast cancer, activities where they are. This was during COVID. What her daughter did for her was to live at a friend's house for the summer when she came home, because she did not want any of her behaviors to jeopardize her mom's health when she was immune compromised. And it was a sacrifice. It was hard on both of them, but they saw each other outside. Let me think. A woman whose son showed his support by getting a tattoo, a scripture that she wrote in her handwriting, and he had it tattooed onto his body with a pink ribbon. At every age, there's something that people can do. They can help out with the cooking. There's a woman who's a member of the Breast Cancer Club who, bless her, when she was diagnosed, I'm laughing because she was funny about it. She had a 13-year-old, a 6-year-old, a 1-year-old, and she was 4 months pregnant. And
Wow.
Everybody could help, though. Her 6-year-old helped with the 1-year-old. I mean, they were potty training this child while she was going through chemo. Everybody can do something, and kids feel really good when there's something that they can do.
Yeah, it's hard, but survivable, right? Like, we can do it, and we can ask for help. So let's talk a little bit about talking to our kids about this diagnosis, right? I think, like you said, parents have a very internal reaction to having to tell their kids that they have breast cancer. What are your thoughts on how to navigate that?
Yeah, it is over and over the thing I hear, that it was so hard, but it went better than they thought. I think it's really important to be honest and open in an age appropriate way. And that might mean multiple conversations. The woman with the 13-year-old and 6-year-old, those were two different conversations.
Yes.
I think it's important to share your feelings and name them with clarity. People describe being frustrated. It's fine to say, I'm frustrated, but I'm okay, but I'm frustrated.
Yeah.
But I think that modeling for them, what do you do when life gives you a curveball. What do? You model that, and they're going to have issues in their lives. They're going to have things come up that they didn't want and didn't plan for, and you can show them what that looks like. How do you handle things, negative things? And it, in so many cases, I've had this described to me, how much closer the family is. They came together as a family, how much better the communication is than they thought it would be, or maybe than they see in other families, because they've talked about personal things, talked about their bodies, how being open to your children's questions, saying, this is not just one conversation that you have, by the way.
Yes.
This is multiple conversations. But, saying, any question, you can ask me any question. And how that leads to closer communication as the kids grow up. Many people say that, I knew my kids loved me. I knew they respected me. Now I really know. What they see in me, and they think I'm strong. One woman says her kids call her a badass for everything that she went through. And, they really respect if you share with them.
Yeah. Yeah. Another thing I think that is important is, with all the appointments comes like differences. If you're having that friend pick them up, or, they are going to this game with this person or whatever, creating like some type of predictability for their schedule helps too. Right. So like not only the talking about the cancer piece, but then also saying like things are going to change, right? Like there's going to be an adjustment period. This won't last forever, but like, this is what I think it's going to look like. And we're just going to flex through this. We're going to, figure out how to navigate it. Yeah. And here's how it's going to go. Do you feel like that's a helpful piece to provide some consistency?
Yeah. And I think, don't we all want adaptable, flexible children? I do think when you can, sure, please keep the schedule the same, the activities the same, if at all possible, allow them to continue the activities. Other people are happy to drive. And guess what? Kids think it's really fun to ride in somebody else's car.
Yes, they do.
Yeah. A lot of people said that their kids had such a, they felt that their kids understood how loved they were when they saw the village take care of them, right? It's one thing to know that you're loved by your family. Your family has to love you. But the self-esteem that comes from understanding how many people love you and care about you and, will take care of you in this situation. Over and over, I hear that as a good thing for the kids. So it's fine if other people drive them. It's fine if, someone takes a video of their at bat and sends it to you, it's okay. The most important thing is that you do the treatments that they tell you to do so that you can be there for the long term and for the future. You may miss a few things and it's hard. I talked to a woman who missed her son's last 2 baseball games ever because he stopped playing, and it was sad. She didn't know that she had already seen the end of that. And it was, there are frustrations. There are things you will miss. You cannot do it all.
Yes. And that is okay.
Yeah. It's okay.
Yeah. And it still sucks. It's okay. And it sucks. That's going to be true at the same time. Yes.
Say that all the time. 2 things can be true.
Yes. Okay. Yeah. So let's talk about how, let's say it's not us that has a cancer diagnosis, but somebody else that we know in our community that has a cancer diagnosis. We've kind of spoke to how you can step up, but like, how can we help our kids understand maybe what somebody else is going through, or make sure that we're being present for that person?
Well, we discussed, the many, many ways to help, and that it's better to offer something concrete. I think holding space for somebody is so important, and that means allowing their negative feelings too. And I had a ton of support. One thing I notice is that sometimes people feel the need to editorialize about your cancer, rather than just listening to how you feel about it. And that's going to change day to day. I did not love it when people told me that it sucked. I never once felt better when someone said, wow, that sucks. Other people don't mind that at all. For me, that wasn't my favorite thing. On the other hand, you can also be toxically positive. And sure, it's great to have a positive outlook. And, we know that cancer patients who are optimistic and positive, like they have higher survival rates and they have less pain, less side effects, lower rates of, spread of cancer. We know all that data. You have to let people go through the hard stuff though. And like when I was first diagnosed, I had been told to expect a mastectomy, to prepare for that. Based on the amount of cancer that they found and the behaviors of this kind of cancer, there was likely going to be more, to expect a mastectomy. So when I was announcing my cancer, I was announcing that I was likely going to have a mastectomy. They did further biopsies, decided that I would be fine with a lumpectomy or a breast conserving surgery. In the meantime, I had numerous people tell me that I was lucky that I was going to get a free boob job. That is not at all what a mastectomy is.
Yeah.
If the patient wants to say that, then fine, but do not say that to the other person, right? You are dealing with the amputation of a body part. All the side effects that can come along with that, pain, loss of sensation, multiple surgeries, there are a lot of side effects of mastectomy. It is not a free boob job.
Yeah.
Plenty of people do talk about that. Plenty of people joke about it, but let the patient do it. And just hold space for their hard feelings. We are all so uncomfortable with hard feelings that we try to ignore them or go upbeat a little too fast. So even a cancer that you're going to beat, even a cancer that you have caught early can come with side effects that last for months and years, and some of them don't even show up for years. So this is something that sticks with you, and you will not ever probably be back to normal. It will be a new normal. But that will be something that changes you probably forever. The good thing is that it can change you in positive ways too. And we can talk about that if you want.
Yeah, please.
Yeah. Well, so this is interesting that for years, research tended to look at the negative side effects of breast cancer. And there are many of them, and they are obvious, including death, right? At some point, they decided to do some research and say, does anything positive ever come of breast cancer? And it turns out that it does. And that breast cancer patients tend to report higher levels of satisfaction with their life than the general population does. And there was a study of, there was one study of post-traumatic growth that was interesting. They studied 100 people. So post-traumatic growth is after you have been through something hard, seeing some benefits, seeing some growth. And it doesn't happen just because something bad happens to you. You have to go through it, work through it, right? And as a result, you can grow. In a study of 100, all 100 breast cancer survivors demonstrated post-traumatic growth.
Wow.
The study of life satisfaction had 8 different domains. Like how satisfied are you with your family life? How satisfied are you with your partner? How satisfied are you with your work, with your leisure time? There were 8 different domains. Breast cancer patients, breast cancer survivors scored higher than the general population in 7 out of 8 domains. The only domain where they were not more satisfied with their life was in the domain of health. But interestingly, they were only slightly less satisfied. And then when they asked people to rank how important that domain is, they ranked health less important than the average person did.
Wow.
So I see over and over people saying that breast cancer is one of the best things that's ever happened to them. So people report being less likely to put themselves last on everything, always taking care of everybody else and ignoring your own needs. They talk about making some positive lifestyle changes where they take their health a little more seriously and, started exercising or losing weight or eating better, which makes you feel better. Being braver. Really not too many things are as scary as cancer. And so once you've done that, there's a self-confidence that comes out of that you can do things and nothing else is that scary. I know that I'm braver. Wasting less time. I'm the kind of person that, like, if I need a dishwasher, I will research all the dishwashers. And, once you've had cancer, you're like, I don't know how much time I have. And I don't want to spend it like reading about appliances, like dishwasher. More decisive, more mindful of how I spend my time. More gratitude, understanding what's really important. That's what the small stuff. Hear that from a lot of people.
Yeah. It's amazing to think that something that seems like a dozens, which we said breast cancer is not a dozens, as long as we're doing early intervention, we're doing scans to figure out, right? Doing a mammogram to see, right? Preventative, or not preventing cancer, but more. Yes, detection. And that then we can grow through it. Right. And I think that's hard. It's overwhelming, but to also give yourself grace to know that this doesn't have to be perfect, but that like there's a lot of growth for everybody that can come out of this. And that on the other side, you'll be thankful for how you handled, right? Like going through it, involving people, including people, taking care of yourself.
Yep. And that's something that I wish I had known in the beginning, because in the beginning you're shocked and really devastated. Who's not? And it is very overwhelming. Those initial days, the uncertainty, then you get a plan. That is also overwhelming because it makes sense. But what they have you do is go meet with your whole care team, usually over the course of one day or maybe two. But these are back-to-back appointments where each doctor tells you everything you're going to go through and everything that could go wrong, which they have to. Most of those things won't happen to you. Some of them might. Most of them won't happen to you. And it's just a problem for another day, really. One thing at a time. And I remember being so overwhelmed at the very beginning about the drug I was going to have to take for 5 to 10 years and all of the side effects. Like, you've got to get through telling people, you've got to get through surgery, recovering from surgery, which takes about, maybe 4 weeks or so before you're ready for radiation, if that's part of your plan. Each thing is a step. I was worrying about the drug that I was going to start in November when I was diagnosed in July, and worrying about the side effects of that and how I was going to deal with that for 5 to 10 years, like one thing at a time. And actually, I do have a few side effects, but it's not anything like what I thought it was going to be. So yes, those are things I wish I had known, is that there are really a lot of beautiful things that can come of this, and, just one step at a time, and don't go there, for things that may not even happen yet. I feel my life has changed in so many ways, and most of them are better after breast cancer, including that many of my relationships are stronger. That can go both ways. There's something called cancer ghosting, where people are uncomfortable and sort of leave you when you're going through treatment. That's a real thing, but I do feel like I am a lot closer with people because I was vulnerable with them. I shared with them. I cried to people when I needed to cry, and I let people help me. And there are, untold benefits of all of those things coming together with other people, being vulnerable, being in community, accepting help. They're blessings. Yeah.
Thank you so much, Julie. This has been such a great conversation. I think oftentimes when we hear breast cancer, we don't want to imagine it being part of our life. We just want it to be somebody else's.
Right. Yeah.
And so then, imagining that it could be ours, or it is ours right now, and that we're getting ready to go through this journey, or we're in the journey, and that when we hear our survivability, that is such a positive thing, but sometimes it just sucks in the middle, right? And it's like, okay, I'm going to get through this, but I still have to do like all of these days. And that can be such an overwhelming feeling. So thank you so much for giving us so much resources through the Breast Cancer Club, and also for just your positive energy around this of like, it can be life-changing in a way that it improves our life after we have completed our treatment and we're on the side of health.
Yeah. Hopefully
Okay.
so. Yep. Thanks, Bryce.
I'm so proud of Julie and all the work that she's doing with the Breast Cancer Club. Thank you, Julie, for everything you're doing to contribute to our community and the world. And with that, I will say thank you so much for your time today. Please take a moment to subscribe to our show. If you would just click that top right corner button and just go down to where it says follow show and click that button, we would be so grateful. If you would also share an episode with a friend or family member, if it has made an impact on you, we would be forever grateful. With that, I will say have an amazing day.
Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.